Hello, everyone. Welcome to Achaibo Clinical's weekly coaching call for the 6th of October, 2022. We're diving into the cold months. So moving right on. We are going to be talking about essential documents. These are the documents that are the foundation for clinical trials, right? So we get patient-related data, and then, of course, we get all these documents, the protocol, the lab manuals, the standard operating procedures, the standard operations manual, logs, lab certificates, all those things that ensure that the trial is being conducted according to ICH GCPs and regulatory laws. Then we're going to talk about navigators, the power of awareness. We're going to talk about failure today in this a really good topic, okay? So let's start with what are essential documents. They are individually and collectively permit the evaluation of the conduct of a trial and the quality of the data produced. Per evaluation, conduct and quality. Those are the key words here. And they demonstrate the compliance of the investigator, the sponsor, and monitor within the standards of the ICH GCPs and applicable regulatory requirements. They also serve a number of other purposes. Filing of essential documents at the investigator sponsor side in a timely manner, guys. That's the key words here. So if you're at an investigator side and you're receiving essential documents, you absolutely want to make sure they're being filed on time. If you get the protocol signature page of a revised protocol, got to file it on time, right? If you have new logs, you've got to update it and file them on time. It's really important because at every moment of a clinical trial, if there is review, the review has to show that everything is current up to the point of the moment of the review. Really important, okay? So it's then trials, we have a lot of documents, a lot of paperwork, and you have to keep up with that. Now, so these documents are the ones that are usually audited, right? I just talked about audits, and they're also the ones that are looked at doing inspection. So when there is an audit or an inspection, they look at the data-related documents, right? Source, EDC, all those systems. And they also look at these documents, the TMF. There's typically a binder, and in that binder, all the documents in there have to be current and up to date. And if it's not, then that is a problem. So you want to maintain a minimal list. There's a minimal list of essential documents that have to be followed, like I said, but it's going to vary per trial. Typically, before the phase of the clinical trial, during the clinical trial, after the completion, that's how documents tend to flow. Now, it doesn't mean that the reg binder that is going to be at a clinical research facility is going to have stage 1 before the clinical trial. No, it's not. You can tell by looking at the binder, the documents that are before, right? So like a site selection letter, if the site has been selected, then that is before the trial commences. You have to be selected. During the conduct of the trial, you have things like the protocol, the logs, the lab manual, and blah, blah, blah. After completion, IRB closeout letters and all that stuff. So you just want to think about it in those terms. And then a description of the purpose of each document and whether it should be filed in the sponsor files or both, right? So we're looking at the TMF here, right? So essential documents, the ISF, investigator site file, regulatory binder, and all of that stuff, that's maintained at the investigator site. The TMF is a trial master file, which has a list of all the documents across the whole trial, right? So you at the clinical research side, you're responsible for a subset of those documents. You're keeping it up to date. The main trial master file that is going to be submitted for during the regulatory process is all the documents across the trial. And it typically goes project, and it goes the study, and then it goes so it's project, country, site. Mostly that's typically how it goes. And of course, then there are documents that are expected and documents that are unexpected, right? So there's a lot, but I won't go into that. Just know that if you're listening to this from the level of the clinical research side, you have to make sure that all your essential documents are maintained and current. And at the sponsor level, if you're wanting to get an opportunity at the sponsor level, then the TMF houses all the documents across all the trials, right? And that is it. So the trial master file, yeah, it's established at the beginning of the trial, both at the institution and the sponsor's office, right? So like I said, it's the TMF, the trial master file, that's the main one, the investigator site file, or sometimes it's called the investigator trial file, or the reg binder is maintained. And a final review of the document has to be performed at the closeout visit. But here's the thing. A monitor performs ongoing reviews. They're constantly comparing what you have at your investigator site versus what is expected that you should have, right? And if it's missing, then they will let you know and provide it to you. Likewise, there might be documents at the investigator site that have not been sent in-house. So that's what the monitor does. They're constantly making sure that the subset of documents for a particular site compared to the trial master file should be up to date. Now, all of the documents addressed in this guidance may be subject to and should be available for audits, right? Audits and inspections, those documents have to be available. You have to maintain a record of the, of the locations of your essential documents. That the clinical research site, you're storing them, you got to know where they are. So just pay attention to this. In the past, everything has been paper, right? The reg binder is sent to the clinical research site and everything is plopped into this binder. But the way that the industry is going is that we're doing more and more electronic data capture of reg documents. So wet ink signatures are not as common as they used to be before. So depending on how you want to go about it, you could request that these documents are sent to you via email, right? The tricky part is going to be when documents are sent to a clinical research site and those that need signature. If you're using an electronic data capture system approved by the sponsor, that is fantastic. You don't have to worry about it. But ideally, everything is kept in binders. But like I said, if you have standard operating procedures that show, hey, you know what, we keep all our documents in electronically, that is fine too. And these documents, of course, have to be supplemented or maybe reduced in advance of the trial initiation based on the importance and relevance of the documents, right? I mean, again, I said it's per study. There's specific documents that are always there. There's specific documents that we use, and they're in the ICS GCP document list, but it's going to vary per study, right? So do not think that the list that is online that you've seen somewhere, that's the only list. It's going to vary per the project. Some projects might have lab procedures done, other projects might not. Some projects might have an electronic diary, others might not. So it all depends on that. And then the sponsor should ensure that the investigator has control of continuous access to CRF data reported to the sponsor. Okay, so continued access. We're now talking essential documents, all the CRFs, all the certified documents have to be made available, right? And if a copy is being used to replace an original document, and it has to be a certified copy. That's the rule of thumb in this industry. It has to be. Many documents printed from systems have a stamp on it, which shows that it's certified. It's basically, there's an audit trail, was printed at a specific time, created at a specific time by this person, right? So that is good. It has a date stamp on there, but if it doesn't, then you're going to have to manually certify it. Yeah. The investigator and institution should have access to all essential documents and records they're generated throughout the course of the trial. So what I want you to take away from essential documents is that, I'll tell you this, one of the biggest findings in audits and inspections is a lack of attention to the essential document binders, because you think about it, we're also caught up with conducting the protocol, right? Oh, the patient has to come in, we have to do all the procedures, then we have to record all the data, forgetting that, hey, guess what? You have the protocol, the binders, or the essential documents where you have protocol signature pages. You have all these other things that have to be filled out. You have logs. I mean, there's delegation of duty, all the different logs, subject logs, investigational product logs. There's a lot of that, temperature logs, right? And sometimes sites forget because you're too busy with the patients. But remember this, you got to make sure you're keeping you're keeping everything up to date. And as a clinical research monitor goes out to a site, you absolutely have to keep up with the essential documents binder. Now, there are situations where there's a lot of data that has to be reviewed, just like the site, right? You have a lot of data to enter. It's extremely difficult, but you have time before the next monitoring visit. So do that. Likewise, a monitor, you might be extremely busy when you get to a clinical research site. There's so much data. We always prioritize informed consent and data, right? For safety purposes, but do not neglect the essential documents binder. Don't let it pile up to the end of the trial and then you're struggling to figure out what you're going to do with it. Great. So let's dive into the power of awareness with 23 failure. Oh, I love this one because it's the one thing that we often do, right? Giving up or saying that I failed when it's not really failure. So we'll explain it. It is entirely possible that you either have had or will have a number of failures in this respect, many of them in really important matters. And here, the way failures is, you can call it challenges or whatever you want, but so let's define this further. It takes time for your assumption to become a fact. Remember, I talked about it. The only thing we're doing here is assuming the willing of the wish fulfilled, that assumption, until it actually becomes tangible with a reality that I can touch in my life. In one of my Facebook chats in the past, I talked about, I think it's the one which says God has left the building. I talked about how the big thing here is that we are trying to figure out, and that's the spiritual walk, on how to bring something that is in an intangible form. This idea that I want to set up a clinical research site. I want to have the best clinical research sites in my country, have them be quality, be the #1 investigator. I want to be the most amazing clinical research associate, or I want to be medical affairs and work for a sponsor company. That is the intangible fact. How do I translate it into the world? It's through this meditation, assuming the willing of the wish fulfilled. So Neville says that it takes time for your assumption to become a fact. Your desire to be fulfilled is directly proportionate to the naturalness of the feeling already being what you want to be, of already having what you desire. Naturalness, you guys, is very key. When we breathe oxygen, do I say, got to breathe in, breathe out, breathe in, breathe out? Breathing is natural, right? It's not something that I have to force. I have to think about, get up in the morning. Oh my God, I have to start breathing now, or going to bed at night. What's going to happen when I sleep? How am I going to breathe? You guys, yeah, you can tell how my brain works. So it's a natural feeling. So what he's saying is that the fact that it does not feel natural to you to be what you imagine yourself to be is the secret of your failure. So failure comes from not feeling natural about the thing that you want to desire, right? I want to become one of the best principal investigators of African descent, no matter where I am in the world, who's going to give my patients access to this innovative industry. And I'm going to take this training. I'm going to do amazing. I'm going to listen to all this information. I'm going to attend my coaching calls. And at the end, I'm going to succeed. But now, what is the feeling? What is the feeling of you already succeeded? What is the feeling of getting up in the morning, going to your clinical research facility, running all these trials, seeing the benefits to your community? How does that feel? That's it. That's the wish fulfilled, and it has to feel natural. And by the way, how is this done? You got to do it over and over and over again until it becomes natural. Over and over and over again, right? What did I talk about? You do it repeatedly, uninterruptedly for a long period of time, and then it becomes natural. And then one day you wake up and you have this incredible facility, right? You get to the shores of your desires, okay? Now, he says the secret lies in one word: imagination. For example, this is a very simple illustration. He says it's natural. Imagine that you are trying to walk and there's a heavy iron that is on you that's preventing you from actually walking. In this circumstance, it will be natural for you to walk, right? You have to feel natural to run. With a heavy iron pressed down on you, it will not be natural to run because you have this heavy load on you. But it is your imagination itself that will save you. So if you are pressed down by a huge iron and you close your eyes and imagine that you're running, you're going to actually see yourself running, and in such a way that it becomes so natural. So when you visualize yourself, you imagine yourself as being this incredible clinical research professional. It is your imagination that will save you. And how does that work? You have to lace it with emotion. Super important. You can imagine all you want. You could just be watching the movie, but it's the emotion. It's the emotion that really causes it to become natural, and you do it over and over and over again. The essential feeling of naturalness can be achieved by persistently filling your consciousness with imagination, imagining yourself being what you want to be or having what you desire. We can study about a regulatory binder, the essential documents. You can get it, you can understand it. It's fantastic. But until you actually feel like you're someone who is in this industry, who has access to essential documents and how that feels, how it feels to know that you're actually part of the clinical trials industry and seeing all these things that you studied. Once you actually feel that, it must manifest in your life. And that's what happens to our students here. That's why we always teach this information along with clinical trials coaching. Very important. Once you know that consciousness is the only reality and is the sole creator of your particular world and have burned this truth into your whole being, then you know that success or failure is entirely in your own hands. Again, nobody is coming to save you here. This amazing universe has already given you all the opportunities that you need to become the person that you want to become. And so it is up to you tapping into the power of your consciousness. I talk about how we have two selves. We have the tangible and the intangible self. You tap into the self that cannot be seen, touched, heard of, and it's there. It's where everything comes from. So you are the sole creator of your particular world. It's you creating it. Now, when they say soul, from the you look at it, is you, but you're creating it with your higher self, right? That your consciousness, whatever you want to call it. And I love how Neville says, and have burnt this truth into your whole being. So this truth that you are the sole creator of your world and that you can assume the feeling of your wish fulfilled over and over and over again, uninterruptedly, repeatedly for a long period of time, right? If you can do that over and over again, and then burning the truth, like, you know, you literally think about burning things, like burning something into your skin, right? I mean, that pain that comes from it, you're burning it into your subconscious mind. If you do this, then you must become it. Yeah. The only reason why you have failure is because it doesn't feel natural. You keep doing it and repeating and not repeating it and stopping and listening to naysayers, because this walk, getting into this industry, it is a walk of courage. It's a walk of saying, listen, I'm not going to listen to people who don't know what they're talking about. I'm going to focus on this information and I'm going to listen to it over and over and over again. I'm going to feel it until it becomes natural, and then I will see it manifest in my world. Whether or not you are disciplined enough to sustain the required state of consciousness in specific instances has no bearing on truth of the law itself. That is an assumption if persistently will add it into fact. So what Neville is saying is that if you believe that it's not going to happen, it's not going to happen. If you believe that if I'm not disciplined enough to go on this path, then, and I don't believe that it's going to happen, then it's not going to happen. You have to have the discipline. The discipline comes from the mind and the spirit. It doesn't come from going in the world and hitting at things, right? It comes from the mind and the spirit saying, you know what, I'm going to do this. When I started in this industry in data management, I was behind a computer and I said to myself that this is not for me. And it's funny because that experience still serves me to this day. But I knew I wanted to get out of that desk and be out in the field. So I became a CRA. I focused on that for so long. And I said, I'm going to create my own company. I'm going to consult. Then that happened. Then I said, no way. There are African clinical research professionals who don't have access to this information. And I'm going to create something that's going to focus, imagine it, deep, meditation, imagining over and over, even in the midst of despair, the worst challenging situations with all kinds of stuff for 2 years. It was just walking in the valley of the shadow of death, as they say in the Christian Bible. But I never gave up, and the journey continues. But one thing I've said is I am on a mission to ensure that clinical trials become normal for minorities, especially those of African descent. In the US, we say minorities, but African descent, everywhere else in the world, in Africa and in the diaspora. So even when you see the light of life go out and all the world is gone, you must not believe that because your assumption failed to materialize, the truth that assumptions do materialize is a lie. In your assumptions not fulfilled, if your assumptions are not fulfilled, it is because of some error or weakness in your consciousness. Don't blame the game. Don't blame the game. Hey, blame the player. You're in a game, the game of life and how to play it, one of my favorite books. Don't blame the game. You've given the rules. You go imagine in such a way that it becomes natural to you. And if it doesn't work, don't say it doesn't work. Because guess what? You haven't used the rules, right? If you keep at this, in a discipline where no matter what happens, we're all busy. Get up in the morning, you visualize, you affirm, you imagine yourself. Assume that if you're in this program, is because you're interested in this industry and you want to be in this industry and want to be the best of the best. The way that this program is organized, I'm giving you information that is the best of the best information. So I'm assuming that being on here, this is what you want to be. So you assume it, and then through a series of interesting things, the how is not your business, things will come to pass. Now, you can overcome these errors and weaknesses. Therefore, press on to the attainment of even higher levels of feeling that you are already the person you want to be. And remember that the time it takes for your assumption to become reality is proportionate to the naturalness of being it. It has to feel natural. It has to feel like you're walking, it has to feel like you are breathing, right? Build, therefore, your own world. As fast as you conform your life to the pure idea in your mind, that will unfold in its great proportion. That idea, as soon as it becomes burnt into your subconscious mind, then that's when everything will come into your world. Okay? Your goal is to imagine it, and then you get an impulse, right? So you get out, you've imagined, you went to bed at night, you imagine yourself, you get up in the morning, and all of a sudden you have an impulse to talk to somebody. You speak to that person. Before you know it, they've given you some information. Or some of you who fell on our program, you're like, wait a minute, I clicked on an ad or an email, somebody told me about it, because your mind was already thinking about it. So that is the deal, you guys. We talked about essential documents, the foundation for clinical trials, but also failure, right? In Neville Goddard's is basically not assuming the feeling of the wish fulfilled, not feeling natural about it. So it is also a foundation. It's a foundation for the way that you can attract things to come to you. So that is our talk for today. I know the end of the year is approaching slowly, but there's a lot more to come. The intention is that with all this material that we now have for you, you listen to it over and over and over and over again until it becomes natural to you. You're already living and breathing the life of a clinical research professional long before you get into the industry, because you listen to this material over and over. You've asked questions, you're attending the coaching calls, you are engaging on the Facebook page, support. And so now you already are, and it must manifest in your life. That is the purpose. So thank you once again, and I will see you guys next week. Bye-bye.